Thank you, Dr. Satyan. Looks like nobody requires an introduction here. Thank you very much. Thanks, Ganesh. He has given an overview of the ocular surface disease, the definition, the symptomatology, the risk factors, and the mechanisms. We would look into a little more detail about the correlation that closely exists between ocular surface disease and the glaucoma population, mainly owing to the glaucoma therapy, and this would be followed up by management in a little more detail by Dr. Ramakrishnan. So again, OSD refers to non-specific symptoms associated with irritation of the anterior ocular surface. And this definition again was highlighted by Dr. Ganesh Raman, so we will not go into the details of the definition and things like that. So why is ocular surface disease of concern in a disease like glaucoma is such increasing discomfort can lead to poor adherence as far as the patient is concerned, and it can also increase the significance of the ocular symptomatology that is involved, and subsequent surgical outcomes are likely to be compromised because many drugs and the inflammation associated with the ocular surface disease can cause a lot of subconjunctival fibrosis and can predispose these eyes to filtration failures later on, and this also results in poorer quality of life in patients with glaucoma. These are just some examples of mild to severe ocular surface disease that have been associated with glaucoma treatment in some of our patients. And it basically is due to irritation of the anterior ocular surface owing to allergic, toxic, or some pro-inflammatory mechanisms. Again, Dr. Ganesh had covered it very well. And the most principal etiologic mechanism, at least in the glaucoma population, seems to be the drug treatment. Both sometimes the active ingredients, but it's got to do more with the preservatives, as we shall see a little later in our slides. And again, Ganesh had highlighted the prevalence of ocular surface disease in individuals with glaucoma, which is slightly higher than in the general population. One of the studies had put the prevalence of ocular surface disease in the general population as 15% in individuals aged 65 or older. But many of the studies of ocular surface disease prevalence characteristics in the glaucoma population seem to say that almost 50 to 60% patients on glaucoma therapy are having some form of either mild to moderate or severe form of ocular surface disease. Again, he had highlighted the study by Fechner, where it was related to severity of glaucoma as well as the number of glaucoma medications used. This is the data from that similar study, which shows clearly that there is high statistical correlation significance between severity of ocular surface disease as measured by the ocular surface disease index and number of glaucoma medications used. The causes, as far as OSD is concerned, in general as well as in patients with glaucoma, would most probably be related to the preservatives, especially benzalkonium chloride, shortly referred to as BAC or BAK. Sometimes there is reason to believe that certain active ingredients, glaucoma medications like beta blockers, are probably responsible for some of the symptoms associated with the surface disease. Again, other causes, miscellaneous causes which we should not be missing, are any other causes for ocular allergy or surface abnormalities, tear film abnormalities, and anatomic ocular lid abnormalities, which can actually precipitate or cause surface problems. Now, coming to BAC, which is seems to be the single most common precipitating factor or etiologic factor in etiopathogenesis of ocular surface disease in persons with glaucoma. It can cause it can contribute to lot of anterior ocular surface discomfort, tear film dysfunction and instability, conjunctival inflammation. So it can lead to subconjunctival fibrosis. It can also cause increase in the pro-apoptotic factors, which can lead on to ocular surface problems. And there have been quite a few laboratory studies which prove the deleterious effect of preservatives like BAC on ocular tissues in cell lines as well as in cellular cultures. And there have been several clinical studies to show the effect of preservatives like BAC and the relationship of BAC to ocular surface disease in glaucoma. And more than half of patients on preserved ocular hypertensive drugs seem to report with symptoms of ocular surface disease, and corneal epithelial barrier function is significantly affected by preservatives like BAC. And ocular surface signs are more prevalent with preserved glaucoma medications than unpreserved glaucoma medications. Now, sometimes active ingredients are also incriminated in the pathogenesis of ocular surface disease, but the majority of evidence seems to support the hypothesis that it is the preservatives rather than the active ingredients which are the cause for ocular surface symptoms. And sometimes active ingredients like beta blockers and prostaglandins may even be protective against ocular surface disease symptoms. And this has been proved by the fact that a preserved ocular glaucoma medications have seemed to cause less ocular surface disease than preservatives like BAK alone. So coming to management, which will be dealt in a little more detail by Dr. Ramakrishnan, there are no specific drugs to counteract the preservative-related ocular surface disease in individuals with glaucoma, and usually management is aimed at reducing the drug-induced surface toxicity, and ocular hypertensive drugs without preservatives and especially without preservatives like BAK may reduce potential preservative-induced ocular surface disease in individuals with glaucoma. And several drugs, glaucoma drugs, which do not contain BAC or contain alternative preservatives, have proved that, and again in cell cultures and cell lines, that they induce less inflammatory mediators like cytokines and other inflammatory mediators, which Dr. Ganesh Raman has been speaking about. And of late, there are also several studies, clinical studies, to prove that preservative-free glaucoma medications like preservative-free travatan, latanoprost, timolol, and tafluprost result in significant improvement in quality of life and reduction in symptomatology associated with ocular surface disorders. Now, switching from the BAK preserved to non-BAK prostaglandins seem to improve the tear breakup times, corneal staining properties, and the barrier function, as well as the ocular surface disease index scores. And by way of questionnaire, almost 72% preferred preservative-free travoprost, and in another study, 70 to 71% preferred preservative-free brimonidine in preference to the preservative-containing prostaglandin or brimonidine. So these are some of the drugs that contain either no preservatives or alternative preservative. Most of them are available for use, except perhaps saflutan, which is likely to be available soon. And in summary, ocular surface disease is common in glaucoma and with presence with significant symptomatology. Prevalence seems to increase with the number of glaucoma medications used as well as severity of glaucoma. And BAK containing glaucoma medications seem to be the principal cause of ocular surface disease in persons with glaucoma. Anterior segment abnormalities, anatomic abnormalities may be contributory. And we require future research to provide more glaucoma medications with alternative preservatives or preservative-free medications that could effectively and equally be effective in reducing the intraocular pressure, and specific treatment for ocular surface disease is still non-existent. So thank you very much for your very patient listening.